The question is, I was diagnosed with endometriosis. My tubes were fine, but the doctor said my endometriosis was still a mitigating factor in my infertility, and that once I had the laparoscopy to get rid of the endometriosis, I should be fine. So I had the laparoscopy 8 months ago, and I'm still not pregnant. The patient is 33 years old, and she's wondering why she's not pregnant and how acupuncture and herbal medicine might help. So, great question. Thank you. Here's my answer. So, when a laparoscopic surgeon does a laparoscopic intervention to eradicate endometriosis, the surgeon sees what appears to be endometriotic tissue. This tissue can be identified because its color is different than normal tissue. It's purple or black or gray. And so the surgeon will resect those that tissue that's discolored. The problem, though, is some endometriotic adhesions look exactly like normal tissue. So the doctor can't remove what he or she can't see. And so even after a laparoscopy, there are patients that still have endometriosis or endometriotic adhesions within the pelvic cavity. And how does it contribute to infertility? Well, endometriosis is an inflammatory disease, and even though it's a disease that occurs outside of the uterus, it still has an effect on the uterus through the inflammatory process. So it makes the uterine environment more inflamed, and it prevents certain things from occurring in the uterus that are necessary for implantation. And so what acupuncture and herbs can do very effectively, very often, is to significantly reduce the inflammatory environment in the uterus, thereby creating a more normal and amenable environment for an embryo to implant and hopefully to have a full-term pregnancy with a live birth.